June is Pride Awareness Month, a time to recognize and celebrate LGBTQIA+ communities, honor the history of Pride, and commit to working together to ensure continued progress. Today, we're talking with CU Medicine psychologist Aimee Zisner, who practices at CU Medicine Family Medicine Landmark, about inclusion and what that means for the LGBTQIA+ community. Thank you for spending some time with me today.
Of course. Thanks for having me.
So why is inclusion important for the LGBTQIA+ community when it comes to healthcare particularly?
Well, firstly, I want to say that I really appreciate this opportunity to talk about this topic because I do feel that it is a really important issue. So access to healthcare is incredibly important. So having an inclusive environment allows LGBTQ plus patients to access necessary medical care without fear of discrimination or mistreatment. We know that people in the LGBTQ plus community often face barriers to healthcare access, which we know leads to poor outcomes and ultimately reduces quality of life.
Are there any issues the LGBTQIA+ community is facing when it comes to access in healthcare, or any health issues that you're seeing? How can providers better help those looking for care?
So we do know that members of the LGBTQIA+ community often face health disparities, including higher rates of HIV and AIDS, high rates of certain cancers, including breast cancers among lesbians, and certainly mental health concerns as well, as a product, at least in part, by the challenges that they experience as part of these communities. So inclusive healthcare environments can help address these disparities by providing culturally competent care and addressing the unique needs of this population. And certainly I do recognize too that requires some trust and development of rapport on behalf of both providers and patients. So there was a study from the Kaiser Family Foundation from 2022. Well, compared people from the LGBTQ plus community with those that don't identify as part of that community, and asked them just if they felt like a healthcare provider didn't believe them when they were telling the truth. 16% of people among the LGBTQ plus community felt that was the case, compared to 8%. When the question was asked if healthcare providers assumed something about you without asking, 21% of the LGBTQ plus community endorsed that, whereas only 11%, so about half, again, didn't endorse that statement. So there's certainly barriers of care, I think, certainly on the part of the behavioral health providers, as well as med providers and other members of the healthcare team. And so I think certainly we have work to do as well to provide an inclusive environment, and knowing that it can be a tall ask, but to, as best as you can, trust your healthcare provider to provide good care. And if you're not experiencing that, to find ways to advocate for those needs or change to a provider that will be able to offer quality healthcare to you.
And just lastly, do you have any advice for someone struggling with reaching out for help?
So it's important to recognize that the needs of the LGBTQ plus community, individuals can vary widely, and each person's experience is unique. So at least from my perspective, our goal is to provide individualized, respectful, and inclusive care. And that's crucial to address these diverse needs effectively. So in terms of some advice for people in the LGBTQ plus community, open and honest communication with their doctors is really key to receiving appropriate and inclusive healthcare, and that this can be a big challenge for some of the reasons I mentioned before. So one way to maybe facilitate some of that communication is to, in advance, research LGBTQ plus friendly healthcare providers. Before scheduling an appointment, consider researching healthcare providers who are known for inclusivity. Look for doctors who have experience working with this community and who demonstrate cultural competence in the space. That increases the likelihood that you'll find someone that will be able to support you in your needs. You can prepare in advance. You can take some time to gather your thoughts and write down any questions or concerns you have prior to the appointment. This will help you stay organized, manage time as effectively as you can, and ensure that you're covering everything that you hope to discuss. Another way to address this would be, as best as you can, to advocate for your needs. So remembering that you have the right to receive respectful and inclusive care. And if your doctor makes assumptions or uses language that is inappropriate or disrespectful, if you feel like you can, please don't hesitate to speak up and provide clarification or express your discomfort. It's essential to advocate for yourself and educate your doctor if you feel like you're up for it. It's not your responsibility, but sometimes those interactions can be especially meaningful.